Hello, and welcome to a short video tutorial covering HMO Basics, with illustrated help from Ben. HMOs, or Health Maintenance Organizations, have been around for years. An HMO is a managed care network of doctors, hospitals, and other facilities who have contractually agreed with the HMO's guidelines in exchange for a predictably high volume of patients. The most recognizable feature of an HMO is the concept of a healthcare gatekeeper, who oversees all levels of care for their patients. This gatekeeper is referred to as your primary care physician. Primary care physicians are most commonly internists, general practitioners, pediatricians, and in some cases, gynecologists. Another distinguishing feature of an HMO is its fee-for-service structure. In an HMO, all levels of care have a preset fee or copay associated with them. A sickness visit costs X, a blood test costs Y, an MRI costs Z, and so on and so on. This is a different approach than other style plans which utilize a cost-sharing arrangement where an insured pays a portion of the cost and an insurance company pays the rest. HMOs traditionally achieve a high level of cost containment by strictly controlling the network of doctors, hospitals, and facilities. To be considered part of the network, a doctor or facility must contractually agree to the guidelines and fee structure of the HMO. The HMO, in turn, provides an avenue for that doctor or facility to acquire patients. By limiting the number of doctors and facilities in the network, an HMO can predict a steady flow of patients to each network provider. As mentioned earlier, as an HMO participant, you must designate a primary care physician and use this physician exclusively for all of your healthcare needs. If your primary care physician deems that you need the treatment of another doctor or specialist or a diagnostic test from a lab or facility, he or she must refer you to those services. If you seek care from a provider other than your primary care physician without a referral, you risk such treatment not being covered by your health plan. Along those lines, most HMOs provide zero coverage for out-of-network care. Stay in-network and you are okay. Go out-of-network and you have no coverage. The only exception to this is emergency care, which should be covered no matter the provider. Historically, HMOs have also been known for their focus on wellness and preventative services. The theory there being that more frequent wellness exams and diagnostic testing will lead to a healthier membership and thus better cost containment. So why should you consider an HMO? In short, the cost. By limiting the size of the network and also providing no out-of-network benefits, an HMO achieves a high level of cost containment, which they in turn pass on to you in the form of lower premiums for the insurance. What does that really mean to you? Well, if you are willing to give up a little flexibility and commit to utilizing one doctor, your primary care physician, for your health care, then you may pay less in premiums than you would in a plan with a more open access approach. Now that we've covered the basics of HMOs, review your plan documents to learn the specifics of the plans available to you. There you go. Now you know. See ya.